us on the map. Mr. Caruana leading the beat. Australia global rank 6. Feeling the heat like immortality.
All right, so in this next video, we are looking at a concept called person-centered healthcare, okay, and how government and non-government organizations collaborate to make this a reality. So person-centered healthcare is about a holistic approach to healthcare, which treats the individual and not the condition. Now, that doesn't say it doesn't treat the condition. Of course, it treats the condition, okay? So an individual presents to ED with XYZ. They will obviously fix that problem, but they will do so in a manner that addresses the individual needs, okay? And not just look at them as a number in the system, okay? They look at them as an actual person. So person-centered healthcare works collaboratively with patients, their family, their carers, and other support networks to share the decision-making and care planning for that patient, okay? This improves patient satisfaction, care quality, and it reduces costs overall because there's more people getting involved to share the load. And it is a key focus of the Australian Commission on Safety and Quality in Healthcare. Pretty sure you should remember that. So as I mentioned, collaboration does occur between government and non-government organisations, and the specific government one that we are going to look at in this video is our local health district, or LHD. So as an example of our person-centred healthcare, my mother went into hospital about 2 years ago now, actually. And I say we were there daily to not only check on her, but make decisions going forward as to what was happening, because she was unfortunately in a coma at the time. So it wasn't just her partner's responsibility, it wasn't just my responsibility, but you know, it was me, her partner, my auntie, my grandmother, the doctors, the nurses. We were all there trying to make the best call for mum. And you know, touch wood, she's out of hospital and doing well currently. So I guess we made the right calls. I mean, I didn't do much, just sat there and anyway, doesn't matter. So that's person-centered healthcare. We'll rub this off and we will go through the collaboration part. So our LHD, so local health districts, okay, they are government entities responsible for managing public hospitals and health services within defined geographical areas, okay, and our local one here is Hunter New England Health, and I'm going to do an example on that on the next screen. So by breaking up the health system into our local health districts, it provides they're highly effective at recognising and delivering specific community health needs rather than just statewide blanket approaches, okay? So remember how we talked in yesterday's video about government allocated, so the Commonwealth government allocating funding to the state government and the state government distributes funding. Well, if the state government just distributed the funding equally to all areas of the state, they're not really gonna hit the needs that's required, because remember I did speak about how our needs here on the coast are different from the needs in rural and remote areas. So the LHDs use that funding to more specifically target healthcare for its community, which is good. It's a smart approach, all right? So what does collaboration therefore look like? So the government, public hospitals, etc., LHDs provide infrastructure, funding, public hospital and clinical services. So they basically, for want of a better word, they treat the patient. Okay, I was going to say fix, they don't fix them. They treat the patient as far as their medical beings go, but then they also connect the patient with NGOs. So our non-government organisations provide specialised targeted support services that fill gaps in the clinical system to overall provide a holistic health approach, okay? So while this one may be more medically and clinical focused, this one is more like dimensions of health focus. So, mental, emotional, social, etc. So you have this partnership or collaboration. So the partnership therefore results in a continuity of care post-discharge. So it provides ongoing social and psychological supports after the clinical care ceases. So the idea behind the collaboration and a person-centered healthcare approach is not just a person rocks up at hospital, gets fixed, see you later. They rock up, they get fixed, see you later, but they also get connected with NGO services that can provide ongoing support and check-ins and things like that, all right? The most common example I can think of off the top of my head is like post-birth nursing care, okay? People go to hospital, they have a baby, all right? That's obviously a very clinical setting to make sure that everything is good for mum, but also for baby's health. Once they're discharged, they then have scheduled regular nursing visits to come and check on them in home, make sure everything's good. If they're having trouble like breastfeeding, for example, they'll connect them with breastfeeding services in the area. So that's like NGOs, right? If they're having trouble, sleeping, they can connect them with, sleep specialists, filling gaps there. So there are lots of examples related to birthing. Actually, I might write it up as well as the stuff on Hunter New England Health. All right, so giving an example of our England Health, or HNELHD. So government and non-government organisations partnership and having collaboration. So government obviously oversees public facilities, and the main one being John Hunter Hospital, abbreviated by JHH, and other public facilities and clinics in the area. Providing emergency care, telehealth services and Aboriginal health services, operates community health programs, okay? That's what the government's doing. How do the NGOs collaborate in partnership with this to provide person-centred healthcare? Well, first of all, we've got collaboration directly with the Awabakal Limited Health Services for Aboriginal people in the area. We have the Ronald McDonald House, which partners with John Hunter Hospital and is based sort of on John Hunter Hospital land, just off to the side, to support the families of seriously ill children, which is amazing. They do fantastic work. Hunter Primary Care, they run non-for-profit mental health care, after-hours services, and they partner directly with the NDIS, which is a government subsidy. And finally, the Westpac Rescue Helicopter is largely community funded, and it provides aerial emergency care straight to John Hunter Hospital. So you can see how these two are working together in partnership. I will wrap this off, and I said I would go through the explicit example of mothers and children, so we'll just do that quickly. And so secondly, we've got this postnatal care example of how the community and NGOs are partnering together to deliver person-centred healthcare. So the government obviously running the facilities, mother receives clinical care, gives birth at John Hunter Hospital, okay? The local health district being, H&E, provides facilities, the obstetricians and midwives for safe delivery and immediate postnatal checks of mum and bub before they're discharged, okay? Once they're discharged, the John Hunter Hospital will then connect mum and bub with NGOs in the local government area, so such as Tresillian or Caritain. So they are non-for-profit organisations which assist with early parenting support, sleep specialists, and perinatal mental health support for mothers who may be struggling with the adjustments to having another person in the house. Another one would be the Australian Breastfeeding Association. So they are a community-based NGO which offer lactation consultants to provide feeding support, education and counselling for new mothers around how to breastfeed if they're struggling, what you can do, etc., etc. So therefore, by delivering both of these services together, mum is now receiving the best person-centred holistic care that they can in all aspects from their birth to the post-birth journey, up to the first 12 months of that child's life. So that'll round out our examples, and that will finish off our video on person-centred healthcare here in Australia. Thanks.